Welcome, everyone. Today we're diving into a major issue that's affecting nearly every household: America's silent obesity epidemic. Think about it. Nearly 3 out of every 4 adults in the US are overweight or have
That's
obesity.
astonishing. It really is, and it's not just a number, it's a signal of serious shifts in our society.
Exactly. We're looking at a problem that's not only reshaping health outcomes, but also impacting our economy and social fabric. And what's striking is that it's been rising dramatically since the 90s.
Yep, I recall it was just over half of adults back then. Right, and now we're talking about almost three quarters, with projections showing this trend continuing at least until 2050. That's a long term challenge, for sure.
And it's not just the adults feeling it. Kids are caught up in this too. Around 20% of children aged 2 to 19 are living with obesity. It's like a domino effect on health, starting so early.
Yeah, the burden on young ones goes beyond physical health. There's a heavy weight on emotional and psychological well being right from the start, isn't it?
Absolutely. Now, when we break it down health-wise, obesity opens up the door to a cascade of issues. You've got heart disease, stroke, type 2 diabetes. Almost 9 out of 10 people with type 2 diabetes are overweight or have obesity.
That's like a domino effect, one issue triggering another. And it goes further than that. Kidney damage, certain cancers, endometrial, esophageal, breast cancer, those risks climb substantially with obesity.
Not to mention the impact on day-to-day life. Sleep apnea disrupting sleep, chronic osteoarthritis causing pain, even fatty liver disease that's often overlooked.
Yep, these aren't just numbers, they're real life disruptions. Speaking of disruptions, did you hear that severe obesity can cut life expectancy by as many as 10 to 15 years? That puts things in stark perspective.
It truly does. And looking beyond personal health, the economic burden is staggering. In 2019 alone, obesity-related costs hit over $700 billion, and projections foresee it ballooning to more than $2.6 trillion by 2060.
Whoa, that's more than triple the current expenses. And we're not just talking medical costs here. There are indirect costs too: reduced productivity, more sick days, disability claims. It's a systemic drain on our economy.
Absolutely. And that system-wide impact deepens when we consider the social dimension. Social stigma and discrimination, viewing obesity as some kind of moral weakness, really stand in the way of effective help.
Yeah, that stigma can actually stop people from seeking the help they need. Exactly. The shame and depression that come with being unfairly judged only add to the barriers to proper care.
And here's where it gets even more interesting. If we only recommend eat less, move more, we're oversimplifying something incredibly
Right,
complex.
such advice misses the mark by neglecting the real challenges. Yeah, because obesity isn't just about poor choices, it intertwines with genetics, our environment, even mental health issues.
So, what can be done? The answer isn't a one-size-fits-all approach. We need policy changes that improve access to healthy foods, safe spaces for exercise, plus community-based education and physical projects.
And let's not forget integrated healthcare that includes counseling and, where appropriate, medication or surgery. And a shift in how society views obesity is critical. Recognizing it as a disease and not a moral failing will reduce stigma and promote empathy.
Exactly. And small changes do count. Encouraging simple activities like walking can create ripple effects, both personally and on a community scale.
Yep, such seemingly small steps can lead to significant improvements. I must say, one thing stands out here. I wonder if some might argue that lifestyle interventions alone are enough. But really, addressing the social and economic factors is just as critical.
I agree, and I'd respectfully challenge that notion. Purely focusing on personal responsibility overlooks the larger picture of systemic issues that fuel these trends. It's like trying to fix a leaky roof by repainting. It doesn't truly solve the problem.
Exactly, that's a great analogy. And while individual actions matter, policy and community support are indispensable.
So, to wrap it all up, we're dealing with a multifaceted epidemic that's affecting health, our economy, and social norms, all deeply interconnected. It's a challenge that will require a coordinated attack on multiple fronts.
Absolutely, it's about dismantling barriers at every level. This comprehensive perspective is key if we're ever to build a healthier future. Each of us, whether through shifting perceptions or advocating for policy change, plays a role.
That's the bottom line. Each step, each small change in our approach to food, exercise, healthcare, even societal attitudes,
Exactly.
can make a significant difference in tackling this complex epidemic.
And hopefully, by understanding all these interconnected factors, we're better prepared to address not only the symptoms, but also the root causes of this crisis.
Precisely. It's a huge problem, but with concerted, well-informed efforts, there's hope for change, both for individuals and our society at large.
Here's to making those changes happen. Thanks for this deep dive. It's been enlightening to peel back the layers of such a pervasive issue.
Anytime. And thanks to everyone listening. Remember, even the smallest positive shift in perception or behavior can be a step toward a healthier future.